Okay, welcome everybody. We've a lot of attendees, so we're nearly ready to go. I'll just let the final few people in from the lobby. Right, good afternoon. I think I'll kick off. I am Caroline Rogers. I'm at HQIP. I'm one of the associate directors. And welcome to our event. We're going to be introducing Clinical Audit Awareness Week 2022 to you all. There's a few of us involved today. Danny Keenan from HQIP, Vicky Patel from the HQIP chair, Josie from HQIP. I have put the introductory slide up in front of you. I won't read it all out. There'll be a chance to ask questions, and the event will be recorded and it will be shared on our website afterwards. And if we don't get to your question, please don't worry. We will pick it up after the meeting. So without further ado, I will hand over.
Oh, thanks very much, Caroline, and thanks everybody for taking the time out to talk with us today about this exciting event that we're obviously launching. I just wanted to take the opportunity to present 3 slides to you, just to make sure that everybody understands what we've been getting up to during the pandemic with shaping the national program, National Clinical Audit Program. We took the opportunity during the pandemic to check out, did we feel the national program was fit for a purpose? Was it fit to move into the digital, the true digital era? And the answer was that we actually felt there were various things that needed to be adjusted and changed. For all the audit providers, you will be able to find the definitive copies of these, the kind of way we're shaping things in the provider's manual. But I'm just going to go through a few of the changes just so that you actually are aware of what's going on. So obviously there was a huge debate when we had this whole series of webinars between assured data, which is the classic, measured all the year, comes in, finishes at March, gets cleaned, gets looked back and forth and worked on, and then something comes out in November or thereabouts and gets released. That's fully assured data, but the problem with that is that it's reflecting on what was happening 18 months before. And there's obviously a huge feeling in our community that timely data, that is good enough for improvement, should be getting out there. And so we're essentially trying to bridge both of these areas by having much more timely data, but also bringing it together at the end of the year cycle or whatever, so that it finally ends up assured as well. And we hope that as we move that into this era, that we'll start being more assured of the timely data as well. And then obviously reducing the burden, and that goes with the whole digital agenda. And I'm sure nearly everybody here is a conversant with the drive into electronic systems and the EPRs. We're not naive to think that EPRs will solve everything, but obviously moving from routine data that the audit can use from EPRs is a very important area for us. Having metrics that are benchmarking across providers is obvious, and having a time sequence that came out loud and clear, that being able to look as the years pass as well as across colleagues is really important, and that goes without saying. And then obviously the metrics being clinical and patient led and patient reported outcomes as well is important, and we can talk about those audit by audit. And it goes without saying a case adjustment, if at all possible, and it is possible with many cases, should be incorporated. So in the next slide, thanks. If we just move on, we'll talk through about alignment. We can't have different versions of the truth. Having the data sources that we all use aligned across initiatives is important. We've been putting a lot of effort into getting results out on the NCAB format. You yourselves are putting a lot of effort in getting infographics. All of this is feeding the same source data which we have, which you've provided, going to CQC, is also now going to model health systems. Our hope is that by the end of this calendar year, that virtually all of the audits that are in NCAAW will also be in model health systems, and that is a really important area that we all need to be linking in with. And then this point 7 is really important. Reducing burden. We did an exercise. We had something like between 6 and 68 metrics between the entire and the different audit in the program. We have basically asked that the metrics should be brought down to 20 in the short to medium term. And if you read the provider manual, it really, the hope is to move to over 10 metrics. This is part of the burden as well. In other words, focusing what are the real questions, what are the metrics to get at that, and timely data, which I've already mentioned. But it has to lead to quality improvement. So that's the whole theme of getting the data back out, the good enough data back out, leading to quality improvement. If you just bring on the next slide. Thanks, and this is the last of my side. So this is a really important. Most of the audits are very wedded to the annual report, but the annual report doesn't get a big impact. It's not well read, and essentially we want an annual report shaped into a much tighter document, focusing on a key finding, a key theme, and recommendations shaped down as well into the really key findings, not repeating a recommendation that was found last year as well. Obviously, having the internet and a website, you can put all kinds of stuff on the website, but when we're actually sending out the documents, they have to be much more focused so they make an impact. And then obviously the local recommendations going online as well, so that it's easy for colleagues putting so much effort into doing these audits to get the messages back. And then interactive, as it goes without saying. And then if we're doing this in much more timely fashion, refreshing the metrics, and we've got here quarterly and you know, moving actually like that this is the direction of travel. COVID has shown this, getting real-time data, getting it back out quickly, it really opens the door for quick quality improvement. I'll just stop there now, and we can take questions at the end. So what we're going to do is I'm going to hand over to Josie, who's the F&M fellow working with us for the year, and Josie's going to take you through the actual process to do with the week. Josie.
Sorry, somebody has to start on mute, don't they? Thanks, Danny. So I'm going to chat to you about Clinical Audit Awareness Week, which is our national campaign run with NQICAN and HQIP from the 13th to the 17th of June this year. We are celebrating the impact of clinical audit and quality improvement. And so to summarise the week, we've got the Clinical Audit Heroes Awards, which I'm going to talk a little bit more about in a moment, where we can share best practice through case studies, and then daily lunch and learn events, which NQICAN will be hosting. So next slide, please. So this year we've got Clinical Audit Hero Awards in 5 categories. We've got Patient Safety Hero, Patient Advocate Hero, Influencing Change Hero, Health Inequalities Hero, and Future Proofing Hero. Next slide, please. So the criteria for the awards, so all of the awards have this criteria. These are going to be available on the website, but essentially you need to be an individual or team that's completed an audit and made improvement in a healthcare setting in the UK. This is since October 2020, so we're reflecting when the last Clinical Audit Awareness Week was, because we've had a delay because of COVID. And you need to have a relevance to one of the award areas. Next slide, please. So the full judging criteria for each award will be published on the HQIP website. We're looking for a clear audit design and evidence-based improvements. Next slide, please. So the key dates that you need to be aware of is that the nominations open next Thursday and then close. This will be announced at the daily lunch and learn events, and the winning entry will have the opportunity to present their work as part of that event. Next slide, please. I'd finally like to highlight that the Clinical Audit Awareness Week Toolkit is available on our website. We'd ask you to really share what you're doing. Please use the hashtag CAAW22 on social media so that we can really share the message around Clinical Audit Awareness Week. Next slide, please. So I'm now handing over to Vicky Patel, who's going to talk a little bit about what NQI CAN are doing.
Oh, thanks, Josie. So NQI CAN have been busy making plans for the week, some of which Danny and Josie have already shared with you, very much from the national perspective. But we wanted to chat with you now, really, so that you start thinking about your local plans, as well as some of your submissions that you might put into the awards category. So next slide, please, Katie. Lovely. So didn't want to miss an opportunity, really, in demonstrating that we've got 12 regional networks that are all members of NQI CAN. 12 networks that actually span the breadth and the depth of the country, so we reach quite far. We've also got further members on the NQI CAN forum as well, might not be part of a regional network, but together we all make up quite an extremely large clinical audit community. And it's an audit community that promotes clinical audit as a quality improvement tool. So if you're on the call today and you're not yet a member of your network, head over to the forum or the NQI CAN website and contact your regional chair, or alternatively email the nqi.can1@nhs.net inbox. So next slide then, please, Katie. We'll have a look at the lunch and learns in a little bit more detail. So Clinical Audit Awareness Week 22 is an opportunity for our clinical audit community to really celebrate everything that we achieve through clinical audit to improve patient care and services, and we're doing this every day. The week it really provides us with a platform to widely let everyone know how powerful clinical audit is as a quality improvement tool. And just reflecting back on the award categories that Josie's already just presented to us, how many clinical audits led by individuals or teams can you identify that you could align and could be submitted to any of these categories? NQI CAN will be running lunch and learns every day, as Josie said, between 12:30 and 2, very much focused around the award categories. So please get these dates and times into your diaries so that you can come and join us, celebrate what we're all achieving for our patients and service users every day. And as Josie said, we will be announcing and awarding the winners for each category on each day. So just to focus on the different categories with you in a little bit more detail. So Monday's focusing on improving patient safety. So we'll have a keynote speaker who will present to attendees on how we are and can use clinical audit to improve patient safety. And you might have a dynamic team or an individual who's really supported a clinical audit that aligns to improving patient safety. So if you can identify any, then get the nominations in for that category. Tuesday focuses on patient advocate, and again with a keynote speaker, really enthusing us all to ensure that we do promote and utilise the patient voice and that we are acting as advocates to influence both policy, national clinical audits and our own local QI programmes as well, because we are delivering care and services that do include improvements or should include improvements that we make as a result of clinical audit, but in a way that matters most to patients. And then on Wednesday, we're going to focus on looking at influencing change. Now, the ultimate aim of clinical audit is to drive effective improvements in practice, but effectively implementing change is not always easy. So how can we actually influence change well? Again, you might have an individual or team that's undertaken a clinical audit in a really innovative way, that's really shouting out to be perhaps shared more widely and recognised for the changes it's achieved. Focus on health inequalities on Thursday. Now, for many years, all of you will know that working audit or as frontline teams that actually we've deterred clinicians from collecting patient demographics unless we can really justify it. But now we need to be really focusing on certain groups or characteristics that we know will have poorer outcomes or lack of access to services. So you might have an individual or team again that's undertaking clinical audit that's actually really utilising their findings to try to drive change that's reducing health inequalities. And then Friday, final day of what will have been a fantastic week of sharing and celebrating alongside highlighting how clinical audit has really informed decision making in making improvements to health and social care. So we know, Danny's mentioned, the last 2 years have seen rapid changes in processes and systems in response to different ways of working. And some of those changes are going to stay. So what projects and teams and individuals have you got that you could pop in for this category about future-proofing health and social care? So we know as clinical audit teams supporting frontline teams that we take such pride in our work and achievements really to really make a difference to patients and service users in making improvements in health and social care. So we all know change doesn't need to be big to have a great impact. It just needs to be the right change in the right way at the right time. And although we all do this for the patients and service users, I think after the last 2 years that really we should use Clinical Audit Awareness Week 22 this year to really just go that bit further in acknowledging, sharing and celebrating what we have achieved and still continue to despite additional pressures. So I know I'm the new chair of NQICAN, and my day job is working at Sheffield Teaching Hospitals within our clinical effectiveness unit, but I know I'm extremely proud to work within our clinical audit community and to hear, see and celebrate where we've all come from and where we're still going to. And as with clinical audit, there's always room to improve and learn together, and that's why I think it's absolutely fantastic that we've managed to get this many people join us today as we start the launch of the run-up to Clinical Audit Awareness Week 22, and we look forward to seeing those worthy nominations rolling in. So thanks, Katie. Next slide, please. Are we handing back to yourself, Caroline, for Q&As?
I think Danny's going to chair us through this one.
Thanks very much. Okay, so that in a short period of time, that was a lot of information we've handed out to you. Are there any, if you use the hands up function, it'd be handy, and we could start seeing if there are any questions anybody wants to ask us about in terms of, there is a question I've got here in the chat box. If there'll be a portal on the website to do with this. Is it, Caroline, do you want to take that?
Yeah, I think Josie's answered it in the chat. So there will be pages on the website with an online nomination form.
Thanks, Karen. Bryn, did you have a question?
Yeah, it was just something I put in the chat box really is, you know, let's go bold and let's be aspirational with this really. And I put about, are we going to actually contact regional and national TV coverage as well really on this, because, you know, getting that message out to the wider people and also the people that we know we're not reaching really. I'm not saying that is the only medium, but let's be bold about that and have that to do. The other part I'd raise is it's brilliant that we've got the health inequalities category in our work. Absolutely brilliant, and praise to the people that have taken the mantle and run with this. However, what I would say is that I think, you know, as we go forward, it's always helpful to make sure that's embedded through all the categories, because I think it's great that we celebrate it as it is in itself. But in reality, what we're looking to do, in my view, is just make sure that's embedded throughout, really. So just a few thoughts there. Thank you, Danny, and everyone.
Okay, thanks, Bryn. As you know, that we're doing a lot of work. In fact, we're halfway through a series of webinars to do with national clinical audit and how it can be used for delineating the problems with equity and diversity. And I suspect there'll be a lot of very important actions coming out of that. And maybe next year we can actually start adjusting the program in the light of what we've the recommendations coming out of that. So thanks for that, Bryn. The point about bringing the television and radio in, I'd love to do that, Bryn, and present this at you know, our presentation, which, if I remember rightly, generally takes place at the board. It was certainly live in the board up to have the cameras and radio, etc. there. So that's a very interesting thought. We'll take that away as well. Bryn, thanks very much. Any other questions that any colleagues want to throw in? Josie, you're just at the key point. You were giving the date. You went muted. Do you want to just say those dates again?
Yep, so the awards open next Thursday, and there'll be a portal on the website. And so in the past, it had been sort of a one-off statement, but now we've broken it down so you can really see what we're looking for in terms of describe your audit, describe how, perhaps for the patient involvement, how you've involved patients, things like that. They will be open until the 6th of May, at which point they will close, and then we will be undertaking the process of shortlisting and judging, and then they will be announced during the week of the event. So at each lunch and learn, the winner will be announced and given the opportunity to present. So the winner will have had some advance warning of this. Don't worry, you will not be put on the spot. By the way, you've won. Can you present for us, please?
Okay, thanks for that.
So that's the 13th to the 17th
Okay.
of June.
And Vicky, I just to ask, I'm just making sure I'm not missing somebody. If anybody sees a hand up, just let me know. But Vicky, maybe I could ask you, is your network fully up to speed so that we have got this out to those doing audit out in the communities?
They are, yes, and so we've got this on the forum. We've cascaded it to our network chairs to get it as far as they can, and it's out on Twitter as well. But we will keep communicating as well to make sure it's getting cascaded as far as possible. Okay, good. If anybody knows any friends who haven't heard about, I'll start actually at the beginning, HQIP, NQCAN, and this awards, please pass the messages on, because we know there's a huge amount of national audit going on. There's a huge amount of local audit going on, and not just in secondary care. Incidentally, we're talking about spanning the whole area of, including mental health, primary care, the community, so it would be really nice to get a lot more traction across the board. As the years have gone by, the traction has increased, but it would be better if we could just pull in everybody who's doing something to do with clinical audit in any of these communities to so we can showcase. This is a showcase of what's good, and once you get a showcase running, you can start to pass messages between each other, and the community then grows and grows. So I'm just looking to see, are there any other questions? There is a question. Carl, hi Carl, far away.
Yeah, thanks to everybody for organising this session. It's really good to focus the mind and help us all think about what's coming in a few months, and it's really nice that we've got some different awards and some clearly thought through, sensibly awards that are a bit different, and it's going to be nice to encompass the larger agenda that we're all tackling, and post-COVID, etc. Or not post-COVID, because we've still got lots of patients in our hospitals at the moment. But Danny, your talk at the start was very interesting and around the national audit agenda. Is there any plans to share that during the week? Because the changes that you've just talked through are ones we've been championing for a while, and I think it'd be a really good opportunity to let other people know about how national clinical audit is being used to drive improvement and some of the successes from the programme and how it's been built into model hospital, etc. I think that would be really useful.
Yeah, that's a very good point, Carl. I guess that the provider manual has been updated. Now that's a very specific document. So in truth, that it is exactly what it says on the tin. It's for providers, and therefore it's not immediately obvious to those doing of national clinical audit in community. I think that point's a very good one, Carl. I think we do put out stuff, but there's always that temptation to keep talking to the same people and not disseminate. So I think we'll take that on board. I'm not sure we'll bring that into the week though. It's I'm kind of hoping, and I suspect going on the last iteration of this, there was an awful lot of very good stuff came in. So when we presented at the end, it was a full-on agenda with colleagues presenting. I think we did 3, 2, and 1 as they do in these shows, and that, if I remember right, it was very full. I think that's something, that point you've made is something that we'll take away and separately address, and I'm sure that could make the guts of a full meeting with not necessarily the audit providers who we've done a lot of talking to, but those doing audits. And that's something maybe, Vicky, we could talk about how to get those messages out to the audit community, because it's so important that we do actually change the programme round to make it fit for purpose, frankly, in a digital post-COVID era. Thanks, Carl.
I was just
you had a question.
Share there, Danny, as well, that the March NQI CAN meeting, HQIP kindly agreed to make sure that we put on a recorded webinar on showing us how to walk our way around the model health system.
Right,
so that we all know how to access the national audits in there, how to pull our data, what these reports might look like. And we did say we'd record that and make that available as well. So even if we can't touch on things in Clinical Audit Awareness Week, by the time we get to that point in June, we could be signposting resources that we're already putting out there, which will help to spread the word and help make it easier for us to all access this information.
Yeah, that's a really good point. I just to warn everybody who maybe hasn't been on model health system, it's a massive resource, but because it's a massive resource, it's not that easy to negotiate, to navigate, is the word. You do get there, and there are tricks to it. So that's a really good idea, Vicky, of kind of a how to kind of guide to model health. Model health is where NHS England Improvement are putting all their efforts into getting out the messages coming from not just National Audit, but GIRFT and many other messages as well. And we're very happy with that because it puts National Clinical Audit not on an outpost, but mainstream with financial information, commissioning information, and lots of other relevant information where they all should be sitting together, and they are. Any other questions coming in? No, I think we're pretty done, and in fact we're pretty good on time as well. If there are no other questions,
there was a question on the chat about when we'll share everything. We're definitely releasing all of the material next Thursday, which is our usual communications point, the last Thursday of the month. So there'll be the awards will go live, the information will go out, the nomination forms will be open, etc., etc. The slides will be available, the recording will be available. So we'll see what we can do before then, but what we're doing is releasing everything next Thursday.
Okay, Brendan, just before I bring you in, there's something in the chat about a colleague in the community who's not getting access to the model hospital. We'll take that away. Obviously, model hospital access is not something we have any control over whatsoever, although we talk a lot to colleagues in model hospital. So actually, if we take that away, we've actually there's not a name there. If you email us with that's a very interesting question. Email us at HQIP and we'll take that back over to Model Hospital to see how we can help that. We'll help you with that. Brendan, last point.
Thank you, Danny, and everyone. I was just thinking again, when we're doing this, whatever really, is there an opportunity to reach out to wider partners beyond health and social care? What do I mean by that? So we're doing a little bit of work with the police at the moment, really, because they've just been inspected by a similar organisation, the Care Quality Commission, really. And I'm just chatting with the Chief Constable, really, because their view is that we develop our policing by consent of people. So again, is that another opportunity to say, it's not necessarily about being commissioned work or whatever, but actually reaching out to other agencies that in the community that can actually support some of that. And the other bit really, Danny, I think it's just by everyone's responsibility just to pick this up and actually just contact their friends and colleagues and just say, are you aware of that? Finally, and whatever really, I just wonder if we haven't looked at this as an opportunity to build a programme of promotional work for 2023 that people can connect in with over a longer period of time, rather than sometimes it's quite short notice to get involved in some of this, really. Just a thought.
Yeah, no, that last one's a really interesting one, and as we go into a new fiscal year, that's something definitely we could start thinking about, because, as I say, the hope has been to grow it, and it is growing, and you can see just by the attendance today, there's a lot of interest in this. So thanks, Brenda. We'll bring that those messages away, and I'll maybe conclude this now, because in fact we're bang on time, so that'll be brilliant. So thanks everybody for joining. Thanks to all the presenters. I think we've got the messages across. This is an exciting opportunity for all of us. We're excited by it, and it's judging by the audience, it seems that you are too. So again, thanks very much. Let's make this really good and showcase all of the great work that's going on around the country to do with National Clinical Audit and its offshoots. So I'll close off now. Thanks very much, everybody, and have a good afternoon. Thanks. Bye now.
Good afternoon to you too.
Thanks, everyone.
Cheers.
Thank you.
Thank you.